I'm therefore pleased to announce that a re-elected Conservative government will build on the national anti-drug strategy with the addition of 3 components. First, our Conservative government will increase resources for the RCMP's clandestine laboratory teams in order to target the production of illegal drugs, including grow ops and meth labs. Second, we will renew the mandate of the Mental Health Commission of Canada and ask the Commission to prioritize research on the links between substance abuse and mental health. And third, our government will support a national toll-free helpline for parents who are concerned about their kids. The hotline will provide parents with advice and guidance to help them recognize the signs of drug use and to prevent their children from using drugs in the first place.
Good morning, Mr. Harper. We're going to be heading to Vancouver later today, where obviously there's the supervised injection site Insight. Given the data about Insight, and given the data about supervised injection sites that you say you're opposed to, and the fact that they, as the Supreme Court has said, save lives and help reduce health issues in the area, why do you remain opposed to it, even though the data show that these actually do good for the communities?
Well, I think the data is very mixed, and I think the real appeal of sites like that is the idea they will be in somebody else's neighborhood, in somebody else's community. Look, our view on this is very simple. We want to help addicts through treatment programs. Providing programs that do not provide treatment, in our view, is just throwing away the key and writing off somebody's life. You know, trying to manage their decline. That's not what we want to do. Our anti-drug strategy is based on prevention, enforcement, but most of all, treatment. And that should always be part of programs for people who are addicted to drugs.
Good morning, Mr. Harper. A number of countries in Europe have legalized marijuana. Some of the southern states next to us have done the same thing. I'm wondering how this announcement today applies to marijuana and how you respond to the criticism that perhaps when it comes to marijuana, you're a little behind the times.
Well, look, I think the truth of the matter is most Canadians, you actually ask them, do not want the full legalization of marijuana. Because they recognize, and I think the statistics in places like Colorado are very clear on this, that when you go down that route, marijuana becomes more readily available to children, more people become addicted to it, and the health outcomes become worse. Look, I would say this. I think it is actually a tragedy. In fact, we have more and more data about the consequences of long-term marijuana use and how really bad they are for health on so many levels. We have gone to so much effort in our country to discourage tobacco smoking over the past couple of generations with great results, with really strong declines. And we've actually seen the same thing. This is actually not known. We've actually seen the same thing with marijuana. Marijuana use has actually been declining. So I think when we've gone to all that effort and we're actually moving in the right direction to turn around and have a policy that could do nothing other than, and has done nothing other than where it's been tried, that encourage people to use it, with all of the health consequences it has, all the consequences of tobacco, of inhaling smoke in your lungs, plus a whole bunch of other things. We just think that's the wrong direction for society, and I don't think that's the way most Canadians want to deal with this particular problem.